Hello everyone, welcome to the Voice of Nursing. My name is Adrian Tracy, CEO of ICG Medical. Today, really very lucky to be joined by Ellen Nicholson.
Hi.
Welcome. Ellen, give us a bit of introduction about your background.
So I started 33 years ago. I started as a pupil nurse in Salisbury, which was a 2-year course, which is similar to the trainee nursing associate programs that we have nowadays, and worked for a year on a surgical ward and then converted to a registered nurse and qualified in 1991. So I've been a registered nurse since 1991. In various guises and situations. Very
good. And sort of give us a bit of an idea of how your career's gone, because I know one of your big passions is being an advanced nurse practitioner still, and primary care. But how did you kind of sort of get into that? Because I think that's quite an interesting career path to go to, coming from that medical into that environment. So
I started off, I was very fortunate actually at the beginning of my career. I worked on a nursing development unit, which was at Charing Cross Hospital, which was run at the time by Janice Sigsworth, who's a chief nurse of Imperial nowadays. So there was a good grounding at the start there, which was dealing with respiratory patients. So I definitely have a respiratory interest and have kept that through my career. But then as you tend to evaluate your life in your 20s. I took a year off and went travelling and worked a little bit in Australia, and landed up working in Germany for a while as a nurse.
Where was that, like on a military base or something?
No, it was in an ordinary German hospital in Munich. And from there I moved into the community, working in kind of German healthcare.
Do you speak German?
I do speak German.
Oh, very well.
There you go. And I met my husband there, he's English, and we had a kind of family there, but then we moved back to Britain in the kind of early 2000s, and I got into general practice. I'd been working in community in Germany, and it seemed like a logical move to go from the community into general practice, and have been kind of aligned to general practice and kind of community since then.
Very good. And sort of take us up to present day.
So from general practice, working in general practice as a practice nurse, kind of building up the competencies and skills there, and that logically led to becoming an advanced nurse practitioner. So I took a degree course at Bournemouth University and non-medical prescribing, worked as a nurse practitioner and moved around in the area I was in. In general practice, there are a lot of competencies and skills that people don't necessarily recognise, so I built up a respiratory interest and moved from there back into the community, working as a respiratory nurse specialist and back into secondary care. So I've gone kind of the full loop really. And then from there I moved into kind of education and training. So what I find is my passion nowadays is kind of definitely primary care, definitely respiratory medicine, but also training and education and how we're bringing on the nurses of the future.
And education is a big topic at the moment, nurses of the future. Maybe just, you mentioned the nurse associate program.
That's right.
Well, how do you sort of see the current sort of landscape, if you like, for the education of nurses or people coming into that profession?
Well, we've just had the NHS long-term plan come out, haven't we, which has got some interesting time. It is an interesting time, actually. It's a time of change, but it's also a time of possibilities as well. But I do think that we actually have to get the groundwork right as well. We're still hearing from nurses who there is still a body of people who say that actually nursing doesn't have to have a degree, but actually I would argue that we do have to have a degree. Times have changed, kind of healthcare is much more complex, and there is so much more that we actually have to understand and manage with our patients nowadays, that we do have to have degrees. So I think you have to have that kind of university element, but then I actually work in a university now, so I would say that.
And what sort of, what's the courses changed? Because you did your degree in Bournemouth, you mentioned, and then what's it like from there to now? What's the kind of differences in regards to the kind of skills you're teaching, or the the depth of knowledge? It sounds there's a lot more going on.
So, I mean, I'm not an expert on education. I'm a fairly recent convert to education, but you have to be incorporating a kind of evidence-based practice into the nurses. You have to be, nurses have to have that voice to actually speak up and speak out. We're professionals in our own right as a profession. We have kind of enormous authority in what we actually do with our patients and how we manage our patients on the wards in a community setting in primary care, and there's a lot of knowledge there. So it's empowering the nurses to actually have that voice in their clinical scenarios and situations to actually speak out for patient care and primary care.
And how would you sort of foresee them raising that profile, if you like? As you say, nurses got, they're on the wards, they're right in the front line there.
I think we need to be a little bit bolder, actually.
Okay.
I don't necessarily think we're always as bold as we could be. And we need to be able to articulate. I mean, you have all this education and learning that you have in your degree programme to become a kind of registered nurse. And it's, the evidence, the research, the long-term conditions, the practical experience on the wards. But actually, we need to be articulating the skills that we actually have. Nursing as a body, we're not necessarily as good at articulating the skills that we do have. And also, some of the work that we do is quite difficult to measure as well. How do you measure holding somebody's hand and comforting somebody, taking the time to talk to somebody, looking out for patient safety? They're quite difficult to measure.
Yeah, we always talk about the softer skills sometimes that nurses have, especially, and I've asked many of the people we've had on this, how do you learn those softer skills of managing the families? Because it's not just the patient, you tend to be, coaching or counselling the families as well, and nurses kind of go, oh, you kind of just do it, or you kind of just, is it a vocational thing, or is it something you learn with experience, or you learn from experienced nurses? As you say, you can't measure that, but that's kind of such a big thing of, in a very stressful situation.
You can't measure it, can you? I think it's a bit of all of those things, really, isn't it? If you, when you're in your pre-registration training, have a particularly good mentor who has skills, those softer skills, as you say, dealing with patients, dealing with relatives, you learn from it, don't you? And I think you learn as much from bad scenarios as you do from good scenarios. So how to handle a good scenario and how not to handle a scenario. And you learn as you go along, and you build up that repertoire of experience, really, don't you?
So you look at it as a learning opportunity with every experience, or you have that experience and nurse talks to you about an example, if you like.
Absolutely. And you're learning all the time, to be honest. You never stop learning. I think if you stop learning, that's the day you probably shouldn't be nursing, because there's always something new to learn. There
is a diverse career, isn't it? People go down such different paths. Talking about you about primary care today, just a different path. Whereas, we've had other people go to chief nursing officers, or other people become, specialists in stoma care, for example, or genomics, as we spoke about earlier today.
I think there's something for everybody, actually. I know nursing doesn't always get a particularly good press, and it tends to focus on kind of terms and conditions, and it tends to focus on pay, of course. But actually, as a career, it's really diverse, you're right, and you can go off in all kinds of different directions, and directions people haven't thought of. So you have public health, you have people working in the independent sector, you have nurses overseas, kind of, doing charity work. And again, you have your chief nursing officers, but also you have nurses in kind of politics. You talked about somebody earlier, didn't you, who was in politics, Ellen Smith, and there's a few nurses. And Anne Keane as well, who worked in kind of Labour government. She was a kind of really good role model. And nurses influencing policy. And I certainly feel very passionate about nurses influencing policy, because obviously health matters to all of us, it matters to the whole population, and to actually have that impact on kind of health policy is really important.
And what would you see the role of the nurse? How would they influence that nursing policy, health policy moving forward?
I think we're integral to health policy, to be honest, actually. Without your nurses, your health system doesn't work. So actually, if you're not taking account of your nurses within health policy, there are going to be things that may not necessarily work within that health policy, because actually you have to have that voice. And
are we seeing any examples of people, bringing nurses into that, that community or into that discussion?
I think so, yes. I mean, if you look at we've got nurses in Parliament now, which is absolutely fantastic. We have a really good CEO. Do we call her a CEO, Donna?
Donna, yes, she is.
Yeah. So Donna Kinnair at the top of the RCN is kind of influencing policy, and the RCN do a really good job lobbying Parliament and lobbying policy. And they have lots of different working groups set up underneath the RCN, which you have representatives feeding into.
Okay, and then that's coming up then into Parliament to make sure it's policy.
Yeah, exactly.
Very good. And obviously you're working with a lot of young people going into the nursing profession with your role. Yeah, or even mature students as well.
Practice is a mixture, actually. In fact, nursing is a mixture. So you have some people who come out of school and they come straight into university wanting to be nurses, but then you also have a significant body of people who actually come to it as a second or even a third career. So they've done a first degree, or they've had some experience in work, and they've come to it as a second career.
And would you say their biggest challenges going into that?
It's different for both they're both quite separate groups. Obviously, if you come into university as a nurse at 18, you're not going to necessarily have that life experience, are you? But you're going to have the enthusiasm, you're going to have the passion. And that's not to say that the cohort of people who have had previous work experience don't have that enthusiasm and passion, because they do. And they also bring transferable skills. So say, for example, somebody's done a degree in psychology, they're going to bring all that wealth of knowledge with them into nursing, or they've got experience working in retail, customer experience, experience. So actually I think you've got a lot of transferable skills, and it's knowing what your strengths are and actually utilising them within the nursing field as well.
I suppose one of the challenges, we spoke to some student nurses we had on here as well, is obviously the bursary and the funding issues.
Yes.
Which obviously you're right at the forefront of that. Speaking with the students and what have you.
So the RCN have started a new campaign about funding our future, which is a really, really good kind of campaign to get people involved in, lobbying MPs. The reality is nursing is a degree that is 50% practical, 50% academic, and it's got long hours, and it's quite difficult for students to actually have kind of part-time work to supplement their income. £9,000 a year or £9,250 a year for your fees, that's not your living costs, that's not your kind of rent or anything like that. It's a difficult choice to make.
Yeah, well, even if they're, we were talking to the student evals, and he was saying that he had, travelling into London. Mm-hmm. And because of the way the shifts are, he's doing it at the most expensive time of day.
Absolutely.
And he said, that's not funded. Mm-hmm. That's part of you doing your course. And he said it found it very difficult.
You don't have the money to do it, really. It's really difficult. There are a lot of nurses who kind of do suffer quite a lot of hardship, actually, kind of financial hardship.
And you've got a second, you're very busy. You've got a second job working with the Nexus Group?
I do, yes.
Nexus Health Group, what does that entail?
So Nexus Health Group, it's a GP practice working at scale. So they are a number of GP practices which chose to amalgamate back in 2016. So working at scale has kind of real advantages. It has the advantage of being able to offer kind of more services out to your kind of patient population group, and to really offer a variety as well. So that was the kind of logic behind it. And they work across kind of North Southwark here in London, okay. And manage 9 sites.
It's quite busy. Do you see that sort of the future of those GP practices? Because I know that came out as well in the 10-year plan, some extra funding as well.
It's difficult to see how single-handed GP practices can kind of financially survive in the current climate. So yeah, I think there is a degree of kind of GP practices, even if they don't necessarily form a partnership, they're forming federations and they're all kind of working together as a cohesive unit to actually kind of provide better services for patients.
Because it's quite tough, isn't it? I suppose people talk about getting appointments at GP practices, and just a lack of staff essentially. Not enough GP. I think was it 4,500 GPs short or something? I think I read the other day.
That's right. There's I don't know. I think it's 4,000, 5,000 short GPs and nurses as well. You kind of up to 40,000 nurse practitioners. There's a real workforce crisis. Yes, we do not have enough nurses. We do not have enough doctors. Not just GPs, doctors really. So and your health service does need those essential people to actually work in it. So yeah, I can understand why people can't get appointments. It's quite difficult. I think one of the difficulties with general practice is need versus benefit as well, isn't it? You do hear of stories of people who have not turned up for appointments, and that kind of raises people's blood pressure, doesn't it, when people DNA their appointments. And there's a debate about how to encourage people to cancel their appointment if they don't actually need it. But there's a lot of new ways of working. So Matt Hancock's brought in kind of moves to actually move to digitalisation of the kind of services, so you can actually have a like we're doing now with the camera screen and have your clinician in front of you, which isn't a bad thing actually. There's telephone triage as well, but you have to remember the population's risen as well. So that's part of the reason why we've got demand on services. Yeah, significantly. Yeah. And from your point of view, what's the sort of most challenging or the most interesting part of your job, either at Nexus or with Southwark? I think the challenge is to stay one step ahead, really. So what's the next thing that's actually going to be happening in the health service? What should we be looking out for? Nothing stays the same, it's always changing. So that's not just policy development and moves from the Department of Health. There's always kind of new research coming out, there's always kind of new initiatives with patient care, patient safety, and it's staying one step ahead of that and thinking, what could be the next thing that we should be thinking about? What's the next priority? What would you say? Obvious question. What is the next priority? What should we be thinking about? Well, I mean, I've got the primary care focus, haven't I? So actually, we know from the Queen's Nursing Institute that actually numbers of district nurses have kind of fallen away over the last few years in health visitors, so community really is a big focus, and kind of raising the numbers of people coming into those roles. So general practice nurses, health visitors, district nurses. We're looking to kind of care for more people in the community and care for them, you know, to the end of their life in the community, and as far as possible avoid those hospital admissions that are unnecessary.
It's quite a big push, isn't there, to push people out of the hospitals and, you know, care for more, do more care in the community. I think they're even talking about doing chemo in the community at one stage.
That's right. I mean, there's a lot of teams, kind of community teams, but they're just under-resourced, and you need to have the staff and you need to have the funding, and you need to have the time to make them work effectively as well. So, you know, they kind of embed them in.
And you were a finalist for the Health Service Journal.
I was.
Yeah, the most effective adoption and diffusion of best practice. Make sure I get it right.
Yeah, that's a long title, isn't it?
Yeah, it is. Tell us a little bit more about that.
So that's a couple of years ago. I was working in City and Hackney for City and Hackney GP Confederation. We had a cohort of general practice nurses, so these are people who are new to general practice. They were working in City and Hackney in GP practices, and they were training in conjunction with City University, an academic programme. And it was about kind of mentoring them, teaching them how to kind of work in general practice, the skills that they would actually need. So, for example, immunising children, managing long-term conditions, kind of asthma reviews, diabetes reviews, public health messages as well. And it was a year-long programme, so supporting the students to do that.
And what was the kind of end result?
The end result was that they are fully qualified practice nurses who are out there in the community working.
That makes a massive difference.
Yeah, so it does make a difference, doesn't it? And it was about writing up the programme and putting it forwards to the Health Service Journal. So, yeah.
To do a presentation, all that sort of stuff?
Yeah, it was actually quite interesting. It was quite intense, actually. You have to do a presentation to a panel.
You mentioned immunisation.
Immunisation, children.
That's quite a big passion of yours. You spoke about the immunisation guides. I think you might have one.
So this is something. So I'm a member of the General Practice Nurse Steering Committee for the Royal College of Nursing, and this is a guide that we developed as best practice guidelines for immunisations back in October 2018. Just to kind of give practice nurses and anybody dealing with childhood immunisations the best practice for childhood immunisations. There's a lot of issues to consider, the right vaccination, the right time, kind of you have vaccine fridges as well, kind of safety of vaccine fridges, safety of vaccines, what happens if there's a break in the cold chain, so say somebody turns the fridge off, those type of things. So it's a guide to help people.
I suppose I'm a father, I'll probably be interested to see how you deal with the kids, you know, how you deal with the children. You know, what are the kind of tips for, you know, for the needles and with the young kids and things like that, you know, how do you, nurses always seem to have a very calm demeanour when they do things like that.
I think we have to be, don't we?
Yeah.
It wouldn't help if we weren't. So I think the top tip is that actually whoever's bringing the child to the immunisation appointment needs to talk about it before they come in and say this is what's going to happen, just so the children are aware. I think one of the worst scenarios is where the child comes in and they really have no idea, and you suddenly present a needle to them and they're not happy, funnily enough.
No, funnily enough. Apart from when they do their jabs on their babies, then they don't have a clue.
Even babies, yeah, they do cry, but you can't explain it to a baby,
no,
can
exactly.
you? But particularly, you know, any child over the age of 1, definitely.
Yeah. And just sort of taking it back to when you started in the nursing career, what, you know, if you look back now and, you know, where you are very successful, what sort of advice would you have given your younger self, do you think, when you were sort of forging that nursing career going into it at the beginning? I
think that you have to follow your passion. You have to find the things that you're interested in and follow that. There is no right or wrong pathway. And you may start off, say for example, you start off and say, actually, I really want to work in theatres, I really want to work in A&E. And then in 5 years' time, you find actually that's not where your passion lies, or your interests have changed. That's absolutely fine, and you can follow that interest as well. There are some people who will stay in one particular area, you know, for their working life, and that's great too, because they build up that body of experience. And there are others who will kind of move from area to area, and that's fine too. We've got spaces in nursing for everybody, and there's opportunities in nursing for everybody.
No, massively. You've even got surgical nurses, haven't you? People who perform operations and what have you.
Yeah, absolutely. There's nurses doing endoscopies, so tubes down, you know, kind of minor surgery, dermatology nurses removing all kinds of lumps and bumps. So yeah, there's all kinds of, I think there's so many possibilities for nurses. You know, I think we just have to grasp them and go with it.
And if you're, you know, say someone's watching this and they're thinking, someone doing, a mature student maybe, someone's looking at a second career, or someone who's, coming out of university thinking, what can I do in my life? If they were to go into nursing, what would you tell them about a nursing career, or what would you say? Look, these are the great top 3 reasons to come into, to be a nurse.
I would say it's a varied career. You're never going to be bored, which is great. You hear of some people who have jobs, that they really don't enjoy. And actually, I think you're never going to be bored. There's always going to be a variety. There's always going to be opportunities. You may have to put yourself out there a little bit and push yourself, but actually there's always going to be opportunities to take on new challenges, meet new people. And it can help you travel as well. So with nursing, you can actually work in different countries, you can move around. And the skills that nurses have, those soft skills again, kind of the people management, they're really highly valued actually. You could move into any area really with those skills. So I think there's a lot of positivity about it. And
how do you sort of, you've sort of seen changes in the nursing, some significant changes in healthcare, let alone nursing. But what do you sort of see the future of, we spoke about genomics earlier. What do you sort of see the future of nursing looking like?
Gosh, that's interesting, isn't it?
Well, I'll see the lottery.
It's changing as we talk, isn't it? So the NMC have brought out new education standards, which are just being talked through now. So that's certainly going to change the future. We no longer have mentors; we have practice assessors. With the change from the Department of Health funding university programmes to students funding their own programmes, that changes things as well. And students rightly are going to want to have kind of certain things in their courses as well. You hear of the kind of added value, don't you? Value for money and the type of things that they might want to have in their course as well. So I think that's going to impact nursing.
What sort of things? What sort of things do the students ask for in the course?
So it could be how the teaching is put together. Are we talking about somebody standing at the front of a room doing PowerPoints, or are we talking about kind of interactive training, kind of one-to-ones, those type of things? Okay. E-learning as well. Certainly the NHS long-term plan talked about e-learning, and I think there is a place for e-learning, and the Open University uses e-learning, but you wouldn't want to replace the face-to-face contact, I think, as well. There's value in that face-to-face contact and group contact as well. I think the opportunities for nursing are massive, but obviously there are detracting factors, and the biggest is the workforce and how many people we have in the workforce and what we're going to do.
Any thoughts on that and how we can get more staff in? Because obviously it takes the challenge we have, I suppose, in the healthcare community is it takes a long time to train people.
It takes 3 years to train up a registered nurse, and then you have to build up the experience on top of that. And even though you've qualified as a registered nurse after 3 years, your training doesn't stop. There's extra courses you have to take on for extra skills and competencies that you build up. This
is the continuing kind of professional development and revalidation.
And I think we have to make it an attractive package. So you have to, I think you have to look at terms and conditions, you have to look at pay, you're going to have to look at kind of making hours more flexible. There is research out that says kind of longer hours, those 12-hour shifts impact on people's health and sickness. So maybe actually we need to look at kind of shortening hours, more flexible hours. But the health service isn't necessarily set up for that at this moment in time. And I think you have to look at kind of health and well-being in the workplace as well. It's not just pay terms and conditions, but actually, things like loneliness in the workplace, how you interact with your colleagues. We know that there is problems with kind of bullying? I don't want to put that in there. No, I don't want to put that in there. No, let's not go for the negatives. But yeah, those type of things. Actually, you've got to look at the whole picture, really. Yeah, because I suppose a lot of nurses are leaving the profession, or they're too stressed. And then they're off long-term sick because they tend to work those sort of 3/12s, don't they? Yes. Yeah, and that can, as you say, they are. If they're understaffed, or if they're very stressed, they do get sick. Or you have a lot of the slightly older nurses in the profession who are just retiring and saying, "Look, I can't do this anymore." I think you have to look at retainers as well, don't you? How can you retain the experience of those who are retiring? Because they've got huge amounts of experience, kind of mentoring students, mentoring kind of whole scenarios, how you can put retainers in place, maybe for them to work part-time and come in and actually kind of supervise a group of people and pass over that experience. You know, you're handing on the future, really, aren't you? Handing on the baton.
Well, they're the subject matter experts, aren't they? Especially if you say they've done that, you know, they've done that ward or whatever for 20 years. They know every, you know, every nook and cranny of it. You know, you don't want to lose that just walking out that door, that knowledge.
So you want to kind of be able to retain that. So I think retainers, I think kind of e-learning is kind of really crucial.
And you know, do you see, you know, how do you think the changes in the healthcare industry as a whole are going to, you know, really affect that clinical practice?
There's always going to be a need for clinical practice, whatever guise you're actually in, whether you're working in the community, whether you're working in a hospital, there's still going to be patients, they're still going to need to be cared for in those settings. So clinical practice is still going to be paramount to nursing care.
And you know, I suppose the interesting thing is, you know, we're talking about all these different changes for nurses. How do you sort of see the nurses' role moving forward? You know, how's society depicting nurses these days?
Depends which newspaper you're reading, doesn't it? Yeah, it depends which day of the week it is. So Ipsos Mori had their recent survey, didn't they? So nurses are the most trusted profession, and they've gone up as well, percentage-wise. I think it's kind of 96%, you know, trusted profession. I think we need to translate that trust into power. Actually, nurses need to be a powerful profession. They need to be a kind of a profession with a voice, speaking up. When you tend to read media reports, it tends to focus on safe staffing, which is absolutely paramount. It tends to focus on terms and conditions, nurses' pay, doesn't it? It doesn't necessarily talk about the experience that nurses have. It doesn't talk about the skills that they have and the knowledge that they have. How many nurses do you see on TV? You see lots of doctors on TV, don't you? Kind of how many nurses do you actually see invited onto the kind of television programs to talk about health and well-being, kind of those type of issues? We need to have a higher profile.
Great. Well, hopefully with the Voice of Nursing, we're trying to help do that.
Yeah, no, hopefully. That's the idea.
Exactly. Ellen, is there any message you'd like to give to our nurses, or, you know, who are watching this? Anything you'd like to share with them?
I think we know nursing is a challenging profession. We do know that it's tiring. We know that people get demotivated, and I would suggest that anybody who is in that situation, they would actually talk to their colleagues and really kind of seek out colleagues and, you know, talk about the issues that they're facing. I think the more you actually talk about these things with colleagues and escalate issues, the more we can actually deal with them. But if we don't talk about them, we don't know about them, and you can't deal with them. So it would be those type of things, really. And it's a great profession to come into. I mean, I've had a great career. Actually, it's still going on. I shouldn't say that.
Yeah, you're not finished yet. Don't be retiring yet.
But it's actually been really varied, and I've met so many interesting people.
Superb. Well, Ellen, thank you so much for your time today. Really, really appreciate it. It's great to hear all the passion you have for primary care.
Thank you for inviting me.
You're more than welcome. Thank you to all our nurses, healthcare assistants and doctors for looking after us all. Thank you for watching The Voice of Nursing. We'll catch up with you again soon.